Hello and welcome to the COMLEX Instant Review. Let's review a cardiothoracic surgery problem. After a prolonged period of orotracheal intubation for respiratory support following a head injury, a 25-year-old man finally awakens sufficiently to allow extubation. As he progressively resumes activity, he exhibits dyspnea on exertion and wheezing to the point of stridor. The most likely diagnosis here is it an obstructive lesion of the larynx or trachea? Is it deconditioning with respiratory insufficiency? Is it reactive asthma, cardiac asthma, or persistent pneumonia? Well, the answer here is going to be A. Obstructive lesion of the larynx or the trachea is the key answer. Keep in mind that the increasingly frequent management of patients with respiratory failure by mechanical respiratory support has led to the appearance of a variety of iatrogenic airway injuries, which are produced either by hard endotracheal tube or the pressure of the air-filled endotracheal sealing cuff. And so lesions may be present along the length of the airway and include erosion of the nasal cartilage and granulomas on vocal cords, or at the point at which the tip of the endotracheal tube irritates the tracheal mucosa. At the level at which the sealing cuff rests against the tracheal mucosa, elevated cuff pressures may lead to necrosis of the tracheal wall. Again, that in turn results in either a stricture or some sort of a softening of the tracheal wall, leading to tracheomalacia. So the diagnosis is confirmed by air contrast radiological studies and bronchoscopy, with attention paid by defining the availability of normal airway for reconstructive surgery. Management is usually complex and may require resection of the involved segment with reanastomosis of the tracheal ends. Okay, so again, the answer here is going to be obstructive lesion of the larynx or trachea, and it's a common finding as the patient progressively resumes activity and exhibits dyspnea on exertion and wheezing to the point of stridor. Thank you for listening to the COMLEX podcast, and good luck in your board preparation.